Morning, everyone. My name is Kyle Leverich, and today we're going to be going over Florence Nightingale and the importance of her environmental theory in regards to nursing. So, Florence Nightingale was the founder of the environmental theory. It was formed during the Crimean War between 1853 and 1856. 10 major concepts of the environmental theory are ventilation and warming, light and noise, cleanliness of the area, health of houses, bed and bedding, personal cleanliness, variety, offering hope and advice, food, and observation. Nightingale's theory emphasizes the importance of cleanliness, adequate ventilation, warmth, and a quiet environment. These are the larger principles that she was emphasizing on during her environmental theory. Better environment equals better health. So cleanliness, organizing the care area prevents injuries, sanitizing the care area limits the spread of diseases, keeping your workplace clean. We see that in modern day with sterilization techniques and aseptic techniques. Proper ventilation. Proper ventilation is basically making sure that the area is able to be breathed properly and that they're not breathing the same stale air they would have before that could have any kind of contaminants. Saw this a lot with COVID, making sure that the air that we were breathing was actually clean and was being regulated out. Warmth. Warmth is a real big thing because it helps maintain the body temperature, which can help maintain various systems throughout the body. Things start going bad once the patient gets to hypothermic, which can happen a lot. Even in a warm type of environment, they can go hypothermic. So making sure that they maintain that adequate body temperature is helpful. And not only that, it helps keep the patient more comfortable and hopeful. And quiet. Quiet is a big one because it helps improve the patient's quality of sleep, enhancing the healing process. If you can't sleep, then that could lead to more degradation of issues along with psychiatric features. So, desired patient outcomes. She pioneered the practice of proper sanitation and improved hospital design. This in turn reduced the incidence of life-threatening fatal infections within medical facilities. Basically, she made it going about to where hospitals were far more efficient with how patient areas were laid out, making sure that those small environmental concerns, which turn out to be big environmental concerns, it could be something as simple as linen on the ground or there was something spilled, making sure those are cleaned up to prevent infection and to prevent changes. These changes additionally decrease the recovery time of patients, resulting in improved patient outcomes, quality of life, and efficiency within the clinical setting. This can also help that they improve patient outcomes, better quality of life. You can also have quicker turnaround times for patients to where they're not as sick for as long, and then you can go around to helping more patients, leading to that efficiency. Her ideas about managing light, noise, ventilation, and warming contribute to overall comfort of patients. Being comfortable can improve patients' mood, sleep, and allows the body to focus on healing. Went over that a little bit in the last slide. Nightingale's approach to care put a greater emphasis on mental and emotional health that is not commonly seen at the time. It was a very big thing, especially back then, where there was really very little emphasis on mental health and emotional health. We saw that during World War I when it came to shell shock, later to be known as PTSD or PTSS syndrome, where that mental health really wasn't cared for or treated properly as it should have been. It was stigmatized. So we have the evidence-based practice. So in her formulating a question, she inquired about the environment and how it may influence patient health. Collected evidence, combined her observations from the Crimean War as well as statistics on patients' morbidity and mortality. Morbidity being how this affects the patient's quality of life, and mortality is death-producing characteristics. Develop first statistical pie graph. And then went to appraise the evidence. The theory she devised was based on scientific observation and coincided with her peers, recognizing its application to healthcare. It wasn't just her collecting and formulating this evidence, she did it with others of her peers as well, getting that insight from others around her. And then integrate. Her advocacy for her theory was widely known, taking on the role of teacher in order to educate the nursing profession of new practices, being able to teach others about this quality patient care and this environmental theory would really go for it to help patients. And then evaluate and disseminate. She continued to monitor, continued to monitor and improve her methods, advocating for environmental changes listed in her theory. Furthermore, Nightingale composed a large collection of written works that are still relevant today. We see that especially with our nursing school, and where in talking about Florence Nightingale, the stuff she did really matters when it comes to patient care today, and that making sure to keep them comfortable, keep them safe, making sure the hospital is organized the way it should be. That stuff is still very much relevant to today's work. And here's my reference slide. Thank you.